Hi guys. Welcome to my channel. Before we get started, make sure to hit that like button and also subscribe to my channel. Pre-diabetes symptoms and treatment. So make sure to watch the full video. What is prediabetic? A higher than usual blood sugar level is referred to as prediabetes. It is not yet regarded to be type 2 diabetes due to its low level. But without a change in lifestyle, prediabetic adults and kids run a serious danger of developing type 2 diabetes. If you have prediabetes, you may already be experiencing the long-term effects of diabetes, particularly those to your kidneys, blood vessels, and heart. But there's good news. It's not a given that type 2 diabetes will progress from prediabetes. Your blood sugar level can return to normal by eating healthy meals, engaging in regular physical activity, and maintaining a healthy weight. Children's blood sugar levels may return to normal with the same lifestyle modifications that can help adults prevent type 2 diabetes. The good news is that if you have prediabetes, making lifestyle changes can help you delay or prevent the onset of type 2 diabetes. A nutritious diet, achieving and maintaining a healthy weight, and regular exercise are a few of them. Symptoms. There are typically no symptoms or indicators of prediabetes. Darkened skin on specific body areas may be a symptom of prediabetes. The groin, armpits, and neck can all be affected locations. Traditional warning signs and symptoms indicating you may have progressed from prediabetes to type 2 diabetes include greater thirst, recurring urination, heightened hunger, fatigue, fuzzy vision, foot or hand numbness or tingling, repeated infections, slowly healing sores, inadvertent weight loss. When to visit the doctor. If you have diabetes concerns or discover any type 2 diabetes signs or symptoms, consult your healthcare professional. If you have any risk factors for diabetes, talk to your doctor about getting your blood sugar checked. Diagnosis. Most adults should start getting tested for diabetes around age 35, according to the American Diabetes Association, ADA. If you are overweight and have additional risk factors for prediabetes or type 2 diabetes, the ADA advises getting screened for diabetes before age 35. If you have gestational diabetes, your doctor will probably check your blood sugar levels at least once every 3 years. Several blood tests can detect prediabetes. A1C test for glycated hemoglobin. This test reveals your blood sugar average for the previous 2 to 3 months. As a whole, normal is less than 5.7%. Diagnosis of prediabetes ranges from 5.7% to 6.4%. Diabetic individuals have 2 testing results of 6.5% or higher. If you're pregnant or have a rare type of hemoglobin, for example, the A1C test may not be reliable. Fasting blood sugar measurement. After you haven't eaten for at least 8 hours or overnight, a blood sample is collected, fast. Blood sugar levels are measured in millimoles of sugar per liter, mmol, or milligrams of sugar per deciliter, milligram per deciliter. The normal range is below 100 milligrams per deciliter, 5.6 mmol, 5.6 to 6.9 mmol, 100 to 125 milligrams per deciliter. A prediabetes diagnosis. On 2 different tests, 126 milligrams per deciliter, 7.0 mmol, or more, a diabetes diagnosis. Oral test for glucose tolerance. With the exception of during pregnancy, this test is less frequently used than the others. At the primary care physician's office or the location of the lab test, you will need to break your fast the following morning. For the next 2 hours, blood sugar levels are checked periodically. As a whole, normal is less than 140 milligrams per deciliter, 7.8 mmol, 7.99 to 11.0 mmol, to 140 milligrams per deciliter corresponds to prediabetes. After 2 hours, a 200 milligrams per deciliter, 11.1 mmol, or higher level suggests diabetes. Normally, if you have prediabetes, your doctor will check your blood sugar levels at least once a year. Children and testing for prediabetes. Children and adolescents are developing type 2 diabetes at a higher rate, which is probably related to the rise in pediatric obesity. The American Diabetes Association, ADA, suggests prediabetes testing for kids who are overweight or obese and have one or more other risk factors for type 2 diabetes, such as diabetes type 2 running in the family, being of a race or ethnicity that is more dangerous, a light birth weight, having a mother who had gestational diabetes at birth. For both children and adults, the ranges of blood sugar levels considered to be normal. Prediabetes and diabetes are the same. Children with prediabetes should undergo a type 2 diabetes test every year, or more frequently. If their weight changes or they start to exhibit signs or symptoms of diabetes like increased thirst, increased urination, fatigue, or blurred vision. Added details. 1C test. Treatment for a glucose tolerance test. Your blood sugar level can be returned to normal with the help of a healthy lifestyle. Or at the very least, it can be prevented from increasing to the levels associated with type 2 diabetes. Try the following to avoid type 2 diabetes developing from prediabetes. Consume healthy foods. Prediabetes is less likely in people who eat a diet rich in fruits, vegetables, nuts, whole grains, and olive oil. Pick fiber-rich foods that are low in fat and calories. To help you reach your goals while maintaining good taste and nutrition, eat a variety of foods. Get moving more. Exercise aids in weight management, burns sugar for energy, and improves the body's utilization of insulin. Aim for at least 150 minutes of moderate aerobic activity per week, or 75 minutes of vigorous aerobic activity, or a combination of both. Lose the extra weight. If you are overweight, you can significantly lower your risk of developing type 2 diabetes by losing just 5% to 7% of your body weight, or 14 pounds, 6.4 kilograms, if you weigh 200 pounds, 91 kilograms. Focus on making long-term changes to your eating and exercise routines to maintain a healthy weight. Quit smoking. Quitting smoking can enhance the action of insulin, lowering blood sugar levels. As necessary, take medications. Your medical professional may suggest metformin if you have a high risk of developing diabetes, Glumetza. Additionally, prescriptions for drugs to lower cholesterol and high blood pressure may be issued. Treatment for juvenile diabetes. The lifestyle modifications advised for adults with type 2 diabetes should be followed by children with prediabetes, including weight loss, eating more fiber and fewer refined carbohydrates and fats, portion size reduction, less frequently eating out, daily physical activity of at least 1 hour. Unless lifestyle changes aren't lowering blood sugar levels, medication is generally not advised for kids with prediabetes. Metformin is frequently suggested as a medication if one is required. Is it possible to avoid or prevent prediabetes? Diabetes type 2 and prediabetes can both be postponed or even prevented. The typical way to achieve this is to lose weight if you are overweight, eat a healthy diet, and exercise frequently. The more health issues you could encounter, the longer you have prediabetes or diabetes. Therefore, even merely postponing the disease's onset can benefit your health. Diabetic complications. Without treatment, prediabetes can progress to type 2 diabetes or lead to other severe issues, such as renal disease, blindness, excessive blood pressure, neurologic issues, peripheral neuropathy, limb amputation, medication to reverse prediabetes. To manage prediabetes, follow these steps. Lose weight by eating a balanced diet. A significant improvement can be seen with a weight loss of 5% to 10%. Exercise. Choose something you like to do, like walking. Aim for at least 30 minutes per day, 5 days per week. If necessary, you can start with less time and increase it to a half hour. Before doing anything more, consult your doctor. Quit smoking. Get your cholesterol and blood pressure under control. If you have a high risk of developing diabetes, lower your blood sugar levels with medication like metformin, glucophage. A prediabetes diet exists? The following 4 swaps can reverse prediabetes and reduce your risk of developing type 2 diabetes even though there is no official diet. Over-processed carbohydrates like white bread, potatoes, and breakfast cereals. Choose whole grains and whole grain-based products. Replace sugary beverages with coffee, water, and tea. Instead of margarine, baked goods, and fried foods, choose healthy fats like those found in nuts, seeds, and vegetable oil. Change to nuts, whole grains, poultry, and fish in place of red meat and processed meats. Prevention of prediabetes. Prediabetes can also be avoided by exercising and eating foods low in carbohydrates, sugars, fats, and salt. Other suggestions are: stop smoking. Limit your alcohol consumption to 1 drink per day. As directed by your doctor, take blood sugar medications. So, that's it for today. We hope you enjoyed the video. Use the comments section below to tell us what you think about the video. Also, make sure to subscribe to our channel and click the bell button to be notified of all the latest videos.